Dr. Hoa Nguyen of the Physicians Advisory Group on. Let's switch gears again. We got your mayors coming up. It's going to be like our own mayor's council meeting. There's a lot of them, and they're on the way here on the link. But hey, good morning, Doctor.
Good morning, guys. Good morning.
Right on. Beautiful day out here. How you doing?
Oh, very good.
So you just got done running. How many miles you run in the morning, Doc?
Do a 5K every morning. It's good.
That
It's
sounds like
nice.
it's a beautiful day to run. Yeah, and thanks for joining us. So what's up? How's it
Hey.
going?
Oh, we are doing. We're kind of stable. We're not improving. We still see 80 and 90, and that's not very good.
Yeah.
But now it's really shift mostly in the house, the gathering the house. So you really have to ask people to stay within their house and not visiting each other. We have to somehow getting better at that because we want to have a goal of just like Dr. Mike was saying, we have to have a goal that near normal Christmas. So we have to work for Christmas. So we have to really stay within our house and not visiting each other and then and pass on to the virus. So we're gonna challenge everybody in Guam and try to work in one goal to see if we can curb this thing before Christmas. So we need each other help, but it's a challenging time because we come up with Thanksgiving and all the holiday, so people tend to gathering at their house. So try not to, so we can have somewhat a Christmas this year. Okay, so we have to all work toward that goal.
We ain't having Christmas, Doc. Come on, get real. These people don't listen.
I'm gonna try if people put their mind to it. It's just 2 weeks. It's not that long to go. So just 2 weeks of stay away from each other, and you'll be fine. So you gotta pass the message out and ask everyone to follow. The other one is that people still. We're going to try to do a lot of education again to remind people that, this COVID-19, people think that you have to have a fever to have COVID-19. The most of young people from 20 to 40 and maybe early 50, you can have just cough and cold and congestion with no fever, but we see a lot of people that think they just have a cold and they not stay away from their family, and then they pass on to the whole family. So if you have any congestion, just try to isolate yourself away from your family members, so that way, you don't pass the COVID-19 to your family member. Again, not every case gonna have a fever, so people have to understand that. So that's part of education that we have to try to do to make sure people understand what the symptom is, because that's what we hear a lot, and then they come back in and they test positive for COVID-19.
Yeah.
So you don't have to have a fever to do that. So just to remind people again, we are 8 months in, so sometimes we forget. Okay.
Do you anticipate any surge or spike from Halloween, Doc? Because you always say it takes a couple weeks.
Yeah, it takes about 10 days to 2 weeks or so, and so we see the Halloween have any surge or not. So we keep our finger crossed, and hopefully, I think I don't see much video or picture of people gathering a whole lot. So hopefully we don't have a surge in that one. The hospital admission still high. Lillian's going to talk about it. We still going to worry about the hospital in the upcoming weeks and months.
You plan on participating in the discussion with the Surgeon General this morning?
We the Surgeon General. I think we're going to try to be on it, just to listen to see what he said. It's very important, so we're going to try. Wanted to hear the message, and it's nice to him to kind of pay attention to Guam and give us a call we way out here. Sometimes people in the state forget about us, but it's nice to do that.
Are you guys meeting tonight? Or did you meet on this past Tuesday?
We kind of get back and refocus in a different way. Guys, the PAC are meeting once a week now. It's on Thursday, every Thursday. The other day, we're going to refocus and meet try to meet with public health more and try to communicate much better between the PAC and public health. So we're going to try to do other meeting and kind of spread ourselves out throughout the week. Because twice a week, we've been passing the same message now for the past 8 months, and we got to refocus and do other things to make sure that once we meet, we have a lot of things discussed. So we're going to do that every Thursday.
Is there anything else going on with that, Doc? So you're meeting once a week now.
You meet today?
No, just because every 2 days is really, really fast, and we don't really have much happen every 2 days. So
right.
I think that by communicating, closely with public health to work out some issue, and get a better picture of how to move forward. I think it's better just once a week. We have a lot of discuss rather than 2 days. Nothing much happened in 2 days.
I see.
Because sometimes things take time to change. So I think once a week can be much more efficient for us. There's a lot of time away from the clinic, away from your patient for this doctor to come together.
How many sick visits are you getting at the clinic, Doc? We're in flu season now. Are you getting a lot of sick people coming in?
Yeah, we have influenza. So people come to get the flu shot. Now there's some few articles out there that say that influenza vaccine somewhat helped the COVID-19 and the battle. So I think that everyone needs to get the flu shot as soon as possible. We are very early. This is like the 3-4 weeks into the flu season. So we got to get in. I hope that we have enough flu vaccine on the island for everybody. But if you don't get it yet, especially with your comorbidity, you better come into any clinic and get your flu vaccine. If you have insurance, most insurance covers, so you don't have to pay anything. So go in there and get your flu shot before they run out the flu shot on the island. I know even AMC, we already use half our supply already. So we have like 5,000-6,000 doses, and it's going very fast. So other clinics have it. So get in and get your flu shot. Really, I try to find some studies, someone for that, but it does help in the COVID-19. So get your flu shot as early as possible.
Hey, have you heard if the Regenron arrived yet?
It's arrived. That's something that we're going to discuss. We're going to try to somehow, it can be treated as an outpatient. So we still discuss an idea COVID-19 clinic. I know there was a legislation a few weeks ago, Teresa Lai. We're still going to push forward for that. Try to get the treatment for people as soon as possible. Mobility, cut down to the mortality. So we're going to try to do that.
Okay. Yeah, you were kind of breaking up. You said discussions are still ongoing about opening a COVID clinic?
Yes. The COVID clinic is we can use Regenron on the outside, as an IV. So, for people who have high comorbidity, we can give them as outpatient early. So, like I said, we have discussed it, and we still push forward. For the question is where we're going to have it and who's going to run it. It takes some manpower to run the clinic, and it's remember this is all COVID-19, so the question is who's going to do it. That's a thing, and where. So it takes time to plan, but yes, we talk about that a lot. because we
Did
need
you say
to
Regeneron is on Guam?
I know from Sabrina that I'm pretty sure that either on Guam or it's going to be here, sometime the 1 or 2 weeks or so. So so we have to start planning. Either it's here or not. We got to stand that up because we know it's coming.
And just
So
what is your response to those who say that if you know the idea is to have COVID patients or people infected with COVID that are on home isolation, that they should stay at home, and by opening a COVID clinic, you would have these COVID patients that are in home isolation moving around and going out into the community, going to this COVID clinic.
Sabrina, those patients be transported safely if we can arrange transport for them, and they just go from their home to the clinic, and they cannot catch another COVID-19 in the clinic. They already have them, so if they can be transported safely, to the clinic by themselves, you're not going to spread anything at all. It's something that it will, treat them early, so to cut down the rate of mortality. So, I'm not quite sure people out there that know enough to make those statements. But the key here is to cut down the hospital admission. The key here is to cut down mortality rate. So anything we can do, and we have to do in a safe manner. And again, if you go to a COVID-19 clinic, your family not going to be there. You're not supposed to interact with your family anyway. You're supposed to isolate it. So those COVID positive patients, they cannot catch another COVID-19 infection. They already have them. So it's the unit just strictly run and control just for the patient that already have the infection only. So I'm not quite sure what those people was thinking when they say that. So it's going to help.
I was going to ask you something else, and yeah, now I remember. Has there any discussions about any sort of stricter guidelines that we may be looking at? Because, as you said, the numbers continue to climb. People are still getting infected. And whatever the plan we are doing now, it doesn't appear to be working, other than to continue to remind people, don't go house to house and, visit people, just stay home. So, I mean, are we just going to continue to keep saying that because it hasn't worked? Are we going to look at any stricter, I don't know, guidelines or anything?
Yeah, put more restrictions. Yeah, put more restriction. I personally, I don't think is in favor of anybody. I think it's now through the 8 months we passed the same message. It's a personal responsibility. No, you respect me, I respect you, and you gotta stay away from each other and wear your mask and not gathering. That's the key. You can put more restriction, but how long it's gonna how long it's gonna last? It's not going to help if each one of us doesn't take the responsibility. I think that the only one that they're pushing right now is just a fine, and that it's work everywhere. It have to. People have to be responsible somehow, and the fine are very easy to. If you get gathering more than 5 people, or you're gathering more than your family that currently live in your house, that's the fine gathering, and that's where all the spread is all about. And people got to understand that we have I have a case the other day. The one person positive in 2 family household, 10 people will become positive, and people got to understand that's where the fine is for, to make sure that those cases doesn't happen. No one gonna search your house if you don't have 20 car parked in front of it. So and you have to do that. We are far behind. A lot of states are fine. Hawaii doing that. It worked wonderfully. To curb their COVID-19 infection. So I don't think there's anything wrong with it, because if people are not respect each other and gather and spread the virus, you have to control somehow. So that's not a restriction. It's just enforcement of the executive order. And I think that to put the island on further restriction, I don't think that's a good idea.
All right, thanks a lot, Doc.
Yeah, you guys just be careful. Again, the challenge to people in Guam is really we have to work each other. Try somewhat. Yeah, we're never going to have a normal Christmas in the 2 months.
Doc, I already
further
told my
from now.
kids the governor and Dr. Nguyen canceled Christmas.
Oh.
Yeah.
That,
I was
The
like, yeah,
Santa
Dr.
Claus-
Nguyen said no Christmas, guys. Cut. Nothing.
Santa Claus had to come. It comes a different way, but
You sound like my daughter.
if we
That's exactly what she said.
We're gonna have to quarantine Santa Claus.
Yeah, Santa got to
He
get
can't
14
just be
days in
coming
the
up
hole.
in Guam, you know. Who does he think he
Flying
is?
all in here, like,
yeah,
It's gotta, mandatory.
We can-
yeah.
Hey Dasher, hey Prancer.
Yep.
Hey Dasher, hey Prancer, hey Blitzen. You got to get your noses swabbed right
Yeah,
here.
get in the deuce
No.
it right now.
Rudolph, you especially, because your nose looks a little red.
That should be the message, Doc.
Try,
Cancel
guys,
Christmas.
I want to go shopping. I want to go eat somewhere. So, okay.
Okay, Doc.
Anyway, but be safe, and we talk to you later. Talk
All
next
right.
week.
Thank you,
okay?
Doc. There you
Take
go.
care.
Okay, we'll catch up with you. Maybe I'll text you tonight. Let me know how the meeting went.
Just a real quick okay, yeah.
Okay.
Thank you, Doc.
Okay, bye.
Appreciate it. 7:25.
Real quickly, the update on the president.